Welcome back to the Move Better podcast. Today I have with me Adrienne Kawabata, who is from Honolulu, Hawaii. And Adrienne is a physical therapist, and she specializes in returning to exercise for postpartum women. Welcome to the podcast, Adrienne. I'm so happy to have you here.
Hey Laura, I'm so excited to be here too. I appreciate you having me.
So, tell us a little bit about your background and how about your own practice and how you got into doing what you're doing now.
Cool. Well, I graduated back in 2017, and after I graduated, I realized I needed some more guidance um, with my practice. So I entered an orthopedic residency program, and I got a lot more, yeah, guidance with treating orthopedic conditions. So my specialty is orthopedics, and Um, I practiced in Arizona for a little while, and then I moved back here to Hawaii, and I worked in traditional outpatient orthopedic settings in busy outpatient clinics, seeing multiple people at the same time. And I always had this desire to have more quality time with my patients. So I wanted to create it for myself, and I opened up my own practice, the Movement Doc, back in 2021 as like kind of a side hustle, and I enjoyed the practice. I got to treat the way I wanted to treat without the restrictions of insurance-based um, rules and regulations and waiting for approvals and or doctor's prescriptions and things like that. There's a lot of hoops to jump through, as you know. So um, I know there's a certain pocket of people that would benefit from one-to-one care, and that's what I wanted to provide. So here we are. And then I became full-time in my practice after my son was born in December of last year. But throughout 2022, I was taking courses on the pregnancy and postpartum athlete, and because I myself wanted to stay active throughout my pregnancy, and I had some patients that were pregnant and even postpartum, and I wanted to serve them better throughout that time. So it's like, what better time? It's like, I'm pregnant, you're pregnant, let's get healthy together. So it just became like my personal experience being pregnant led me to want to learn more about how to help this population. And so here, yeah, after my son was born, I went all in my business, and I became full-time. I mean, like I'm like part-time part-time business, but full-time mom. So I don't even know what defines full-time anymore. But yeah,
Yeah.
I don't work in a traditional clinic anymore. I work with my own practice, and yeah, I'm here to help women feel better in their bodies, and yeah, stay healthy for themselves and their kiddo. Yeah.
I think that's a huge gift that you give because I'm currently working with a handful of postpartum women who, they're like, I just don't feel like I can get back. And the doctor said I can go fully, but I tried and it didn't feel right. And like that's the same story over and over again. They're like, I don't know why they didn't refer me earlier. And I think we don't recognize and this is not to be a diss against doctors or anything, but like they just don't like, okay, your body's fine, you're done with being pregnant, so go on with your life.
Yeah.
And um, this is sad sappy. I had a miscarriage back in 2010, and I was like second trimester, and like, and I don't have, that was my child, but and I wasn't able to, whatever, moving past that,
Mhm.
just in that 15 weeks that I was pregnant, like my body changed so much, and getting back in, like I remember the first time I went back to the gym, I cried my eyes out. But like for the first like 6 months, every time I just took a walk, like everything hurt, like all my pelvic ligaments. I was like, what is
Yeah.
going on? And that was half, not even halfway. Like, so,
Yeah.
um, so I think it's hugely important that, you know, you're, you're teaching people how to move and exercise and do that, because we all think like, oh, I can just get right back into it. And there's a lot of things that you can do to make it feel better because your body changes. So that leads to
Yeah.
my question. And sorry to dump that random
No, I
question.
mean, thanks for sharing. I had no idea, but I'm glad that you came through it and look at you now,
Yep.
helping other women become stronger.
Those hardships definitely they make you stronger and they push you to do different things. So what are some tips or like what kind of things do you see in the clinic that people are coming complaining about, like at postpartum?
Yeah. So first of all, it's hard to find them because they have to get referred. And by the time that they get referred, something is really wrong. It's never really like um you're you should just go get looked at prophylactically, right? It's always so most of the time they got back into exercise and they they're dealing with an old injury that just got way worse, or they just they're not performing at a level that they want to. It's like I don't know how to get my endurance back up, or yeah, every woman's journey is so different. But I want to say they're honestly they're kind of hard to find, these women, because they either they shy away from returning to exercise because they got discouraged, but the ones that finally like want to seek out care, they're dealing with some kind of knee pain, hip pain. I'm not a pelvic floor physical therapist. I work alongside and a pelvic floor therapist, and I refer my patients to her first by all means because I value the skill set that this type of specialist physical therapist has, because I don't do any internal work. I just kind of screen. There's like pelvic floor screening questions. Are you leaking when you're coughing or sneezing? Are you having pain with sex? Are you, there's a list of questions that I kind of run them through, and they're asked if they're checking yes, yes, yes. It's like, let's get cleared through a physical pelvic floor specialist first before you really start with me. So back to your question, like what kinds of things am I looking, what kind of issues am I seeing? It's more of that, but there's key things that I look at, and I kind of created a checklist because I wanted every woman to know postpartum like what to look out for. So I'm kind of going to go over that because I just thought that that's a great place to start. So I identified like eight things. The first one, getting medical clearance. So if you've had an uncomplicated birth, just generally that 3 month mark is a safe time to start to ramp up returning to exercise. However, you want to get cleared from your medical doctor or a midwife that agrees that like, hey, yeah, if you had preeclampsia or any other medical problems during your pregnancy, that all that is clear now. Okay, like now you can feel safe, and I can feel safe getting you back to exercise. So yeah, one is medical clearance. The second is get a pelvic floor assessment. So seeing a pelvic floor specialist is the standard of care in so many countries outside of the US and Europe in particular. So in France, every woman that has given birth, doesn't matter if that was their second or third birth, the French government covers 10 to 20 visits of pelvic floor physical therapy. That's
Wow.
just like their standard of care. They give birth, they get assessed, and they get, treatment. Whether they need the 10 and 20 visits or not, at least they got assessed for whatever. I can't speak to it because I wish I could talk to somebody that has given birth in France, and that'd be a great second episode actually, just to see what that care is like, because um, we get like the doctors here are different. I don't know what their their clinical reasoning is or anything, but giving birth, even if you had especially a C-section, you had surgery done, that's a form of injury, and giving birth is a form of overstretch injury if you had natural childbirth.
Yeah.
And if we pulled a hamstring, we go to our doctor, they say, oh yeah, rest for 6 to 8 weeks, and then, you should get some physical therapy to get back into exercise again. When you give birth, it's like rest for 6 weeks, don't have sex for 6 weeks. And then, yeah, you just ease back into exercise.
Yeah.
Do what you're doing before. It's like they don't get referred to physical therapy. It's crazy.
Right.
But when you think about it, it's like you just had a pretty major injury per se, or a really major change to your body. But this, we don't get that guidance.
Yeah. That that's people have said that to me frequently. Like, I don't know why they didn't refer me. I don't know why, I had to go and ask, and like, you said 12 weeks. Like, a lot of people are like, oh no, it's 6 weeks. You're good. Like,
yeah. And it's not like you're doing nothing for 6 weeks. At least in the program that I'm trying to develop right now, it's like the first, what should you be doing during those 6 weeks? It's not like doing nothing and then magically your body will feel different at 6 weeks. It's like, okay, what are you? So that's the next one of the things that I want women to know after. It's like you establish good awareness of your pelvic floor and your breathing again, because that's kind of your baseline. I guess, yeah, reconnecting with your body again, because these areas of your body has been transformed a bit. So during that first 6 to 12 weeks, you're not doing nothing. You're building awareness of how to control your abdominal muscles again, your pelvic floor muscles, how to do a proper contraction, aka Kegel, and then also a proper relaxation of the pelvic floor muscles. And so, yeah, that was another point that I wanted to bring out, because yes, those are the muscles that got injured per se. Your abdominals just got slowly stretched out over 9 months, and especially that third trimester,
right.
they were, rapid growth is happening. So it becomes a little bit more accelerated, especially. And then, I like to describe your whole torso is like a can. The top of the can is your diaphragm. The outside of the can, the round part, is your abdominal muscles, your back muscles, and then the bottom of the can is really your pelvic floor. So throughout the 9 months, the pelvic floor muscles, that bottom of the can was like, stretching out, making space for baby. The side of the can is stretching out, making space for baby. But this can doesn't pop.
That's I know.
That's just like the analogy that I have.
Right.
But it's just retraining those muscles again to have a stable core again, per se. Yeah. So, so it's about establishing that pelvic floor awareness, and that breath is what I like to do. So another point is, you returning to exercise, you have a plan that starts slow and builds. So even if you were active throughout your pregnancy, you are starting with where you're at today. Like, even if, like, for me, I was able to weightlift and run throughout most of my pregnancy. So I really stopped running at about 8 months, because once I started running around then, I started to pee, and I'm like, my pelvic floor, I did all the pelvic floor strength, and I was like, no, I think it's just walking was fine. So I just began to walk a lot more. So even if a woman was running all the way till she gave birth, what happens after birth is you can start with where you're at. So, because it just depends how your birth went, if you had a C-section. So you have a plan that starts slow and then builds, and it starts where you're at. So if just walking or doing daily chores is already a struggle, or even a brisk walk causes some leakage, your exercise regimen needs to just match what you're capable of. Yeah. So
And, so do you have an assessment? Um, what does an assessment look like when they come in? Like if they, uh, I'm thinking that you have a long, like a good conversational assessment, but I know you don't do internal. So what does an assessment look like for you?
well, basically it's the their awareness of like how to contract their abdominals, what their glute strength is. It almost looks like a regular orthopedic assessment, honestly, but just consideration of what their main issues are. If it's back pain related, then we all, I guide the assessment to be to hone in on those areas. And usually it's like assessing like hip mobility, low back mobility, like overall spinal mobility, and then like a movement assessment, like a squat or looking at their gait. But just seeing where your weaknesses lie. If it is a mobility issue, it's usually more of a strength issue, and recruiting the abdominal muscles again is where you'd start, where we would start. So just looking at, yeah, movement patterns would be part of the assessment. And if, let's say, mom is, a year postpartum, let's say just she's way past that 3 month mark and she wants to get back to running, then I run them through the same return to running screen that I would with any athlete that even didn't have give birth. It could be, yeah, anybody. So if you have plans to get back to running, you would go through this return to run assessment. So that's what I end up doing so it's a series of different skills that we run through, and based on how you do with each section of the exam, it's kind of a test. It's kind of an exercise in itself. So like take, for example, doing a single leg bridge. Are you able to hold your pelvis in a stable manner? Because running is really a series of single leg hops, and how controlled each hop is going to determine how much load is going to go through your foot, your knee, your hip, your back, your whole pelvis. So that's what the return to run assessment would look like for for anybody that's trying to get back to running, especially mom. Yeah.
Yeah, I think people don't realize how much the core being diaphragm, all the abdominals, and like you said, and the pelvic floor affects lower body and upper body. But running in particular, people are like, why do I need core strength when I'm running? And that's a huge reason that people have, orthopedic injuries or problems as they go forward. And in essence, it's not that pregnancy causes an injury, or it's not an injury per se, but your body has gone through a traumatic experience,
Yeah.
big changes through your core. So that's a big thing to get back to.
Yeah. And especially, I mean, now that you shared about what happened to you at 15 weeks, your body has already changed so much. And I think that goes to say that, yeah, even somebody that only went through 15 weeks of pregnancy, there is a lot of changes that happen that need to be addressed. There's a lot of hormones that end up changing throughout your body that need to kind of wrap back to your normal again. So yeah, there's so much.
I think I find that, and maybe just because we're females and go through this every month, but even just normal menstrual cycle and period changes and the time you're ovulating, like your hormones fluctuate pre-pregnancy, and that changes your body a lot. And it changes a lot, but not that it's like detrimental, but like your body does go through changes. And then flip side, after pregnancy, all those hormones are all chaotic again. And that plays a big part in what ligament stability is and how your body's going to react and feels and moves.
Yeah, yeah,
Uh, can
yeah.
you touch a little? Do you work with people with diastasis at all, or have you seen anybody with diastasis?
Yes, yes. For that, I am always kind of referring them to my pelvic floor physical therapist, but I can treat that as well. But it is like there's so much. Like I don't know what your question is about diastasis, but go ahead.
Well, at what point should it be concerning, and what point should you go to a pelvic floor therapist versus an ortho physical therapist?
Yeah. So
Are there any other like for people that are either pregnant for the first time or potentially postpartum and having a diastasis, or any information for them?
yeah, the thing about diastasis recti, it's like 100% of the time you are gonna have it. Your belly is expanding. It's just a matter of postpartum, like how you're recruiting those muscles to approximate again. And then the depth, there's different ways to assess the diastasis. It's like the width, but also the depth, like how far can your fingers, so you wanted to do a self-test right now. You're laying on your back with your knees bent, and you find your belly button. You kind of stick your fingers through there, and then you lift your head. Hey, are those muscles around it tensing up and kind of kicking your fingers out, or are they not? Is your finger still able to stick in there quite a bit? So anything more than two, I think 1.5 of your fingers is like considered like too wide, but also the depth. So the only reason why I would refer somebody to a pelvic floor specialist at that point, it would be if they kind of go hand in hand. Having a severe diastasis, it almost always comes together with some kind of pelvic floor dysfunction. So I'd want them to get assessed for any kind of pelvic floor weakness. So that's at least to start with. And then she and I have this things like once she kind of gets their symptoms, like they're not coughing or sneezing with leaking or anymore, or their diastasis has become managed, like usually she refers them back to me when they want to get back to higher levels of activity, like running and things like that, because she kind of found her niche is like the pelvic floor things, but getting to like higher level things, she's like, that's exercise programming and all that things, like that's all Adrienne. Like go see Adrienne after. So I consider all those things when they've kind of had their pelvic floor assessment. So I hope that
Yeah,
answered your question.
yeah, and I think that's a good takeaway for someone that is, that has diastasis or is questioning, or and is working with an orthotherapist. Like, do they have a pelvic floor therapist that they work with that they can send you to? And to the orthotherapist, like, okay, yes, it's okay. Like, that's a great working relationship. That, because I think a lot of times we get territorial, like, oh, I have to do everything. But when you can blend and you can refer back and forth and you can work together, it's the optimal way to get someone back into doing exactly what they want to do. So
Yeah.
that's it, and it's also, although it's one system, it's also multiple systems. Like, so there's the ortho component and there's the pelvic floor component, and that they're very intricate, and so having the specialty to kind of correct them, I think, is uh, a huge way to help clients get better with that.
Yeah. Yeah. Um, so yes, the diastasis can be can be tricky to overcome, but there's definitely a way to get that to be a functional diastasis, because sometimes it will always be there, but if they have that muscular control again, to approximate it when they're like getting out of bed, or if they're doing some kind of abdominal exercise, it can create that corset type of support that your spine needs. Yeah. Yeah.
What else
Okay.
is on your checklist?
Yes. So one of them is you prioritize rest and nutrition. So let's face it, you're not sleeping well right after baby. Your baby is demanding for all your attention and your love. So if you're trying to get back into exercise and you're not sleeping well, you're not going to recover well. So, I learned in my courses, like, there's going to be seasons of your life that you're going to be able to exercise more, and there's going to be seasons where you won't get that much time for yourself to exercise. And that's kind of the hard reality of being a mom. It's like, well, I'd love to go out and exercise and go for a run and go to the gym right after work, but I got to go home and take care of my kids or whatever it may be. So, and it won't always be that way, but so just know that if you're forcing exercise into your life, and that's another point, your mind and body should feel ready to get back into exercise is another one of my points, but back to the prioritizing rest and nutrition. There's going to be days like, wow, I had, baby only woke up once last night. I feel pretty good, maybe I'll go out for, you go to the gym and get back to exercising again, but it's going to be different. So that's kind of the point that I wanted to make, but then also to not be afraid to recruit your village. So your partner, your family, your friends, especially at a time that they're babysittable, they're willing to kind of play with others and things like that. Like right now, my son, he's 8 months now, and like now I feel comfortable. Like if a friend wanted to watch him, like yes,
Yeah.
he's not as needy as he was like when he was 3 months old. So it was a lot different. He's more robust. But anyway, yeah, recruit your village so you can take time for yourself to either go take that nap or to have a self-care day. So there's some time in your life that you're prioritizing your rest and your nutrition, especially if you're breastfeeding. Your nutrition demands and your energy demands are totally different. So that alone will, as you're getting back into exercise, will reduce your risk of injury just by prioritizing rest and nutrition. Yeah. So yeah, back to the other point, your mind and body feels ready. So I remember when I was freshly postpartum, like I felt pretty good. And I was kind of, after, I forgot how many weeks, I was like, it was definitely less than 3 months, but I was itching to just go out and like actually get my heart rate up. I was like, all I did was stay at home, nurse, and change diapers and take naps when I could. But after a while, I was just like, man, I guess I haven't even sweat in like weeks. Like I just want to go out and move my body again. So if like that's where my mind was, but was my body ready for that? So I was like, okay, I'm ready for exercise, but like let's just go out for a walk today versus just trying to go hard. Like, yes, I want to go for a run. Like, no, if your mind and your body must kind of like have an agreement that you're ready for exercise. But yeah, and then the last point that I wanted to make was you understand that it's about moving forward and not getting your body back. And that was kind of a hard one to digest a little bit, because I think a lot of women think about like, oh, I can't wait to get pre-baby weight back, or like pre-baby body back. But I mean, it's a personal journey, but that puts a lot of pressure on mom to yeah, to get back where she used to be. But there's something that big that just changed in your life, and just coming back to like, will it bring you joy if if you're trying to, get your body back? This is like, there's a big identity shift that happens after being a mom. It's like you're more than just whatever you're like, I'm more than just a physical therapist. I'm more than just your recreational athlete. Now it's like, if I strongly still identify as those things, then yes, like I'm, because it brings me joy to do that again, then yeah. But if you're just doing it just for pure like aesthetics, the the drive behind why is gonna not be as strong, and it may be a little, I don't know, just less well-rounded, I guess. Like, it has to bring you joy is what I'm trying to say. So it's not all about getting your body back. It's just like remembering that you are you're a new person now, and who you are moving forward um is who you, yeah, whatever you choose it to be. And it may be different, but that's okay. Yeah.
I think that can be a hard uh, piece for people to remember. I mean, once you have a child, you don't go back to who you were because now you're mom, or mom and dad,
Yeah.
and you have so many other urgent things to take care of. You have to feed
Mhm.
someone else other than yourself. And I think a lot of people like. I think it's also very good to have some time to be able to go out and like, time away from the baby to be able to breathe, regroup, catch your breath, remember who you are. But remember that this is all part of the process, and you're putting those pieces together of, what, like you said, what brings you joy now, and and you blend that, and maybe even using exercise, like um, exercise for more than just aesthetics, because
Mhm.
exercise in itself, I was just listening to the Feel Better, Live More podcast, and they were talking about um, the brain effects that on the hippocampus and the exercise, even 10 minutes of walking, which isn't, for 30 minutes of exercise, but 10 minutes alone and walking will increase the hippocampus and help with memory and mood. And it can shift so if when we're not going to dive necessarily at this time, we can later if you want, but about postpartum depression. But like exercise is very important postpartum because it does help your body recover from the 9 to 10 months that you just went through, um, and the growth changes and all those changes. But you have to respect that process that you had 10 months of getting to there, and your body has to recover and heal from it. And it should be an enjoyable process, not a punishment to go out and get your body back so that you look, the way you did before you had a baby. That's
Exactly.
a huge point.
Perfect. Yeah. That's
Yeah.
exactly what I was trying to say. Yeah. And just to remember that we have the rest of our lives to really like prioritize exercise, like how it used to be. There um our babies will only need us like this for only so long, and just adapting your exercise regimen to just have this happy medium of like, I'm doing this amount of exercise to keep me healthy and happy, and also it's not going to look like how it did before baby, because your life is totally different after baby. So it's and just remember putting it into perspective, like, yeah, our babies are only going to be this cute and little for so long, and it's just a phase of our life that, and then when they become teenagers, they're not going to want to do anything with us. It's like, yeah, well, now's the time to go to the gym,
I,
since he or she's going to hang out at the mall with friends and whatnot. Yeah.
yeah.
So there's a phase, there's a chapter of our life. And right now, at least early postpartum, yeah, it's going to look a bit different, but it's not going to always be that way.
Yeah.
Yeah.
Got some good items on that, and like ways to like having lived through it. I think that's huge,
Yeah.
and
And I'm still learning. Like, I'm only he's only 8 months and he's already taught me so much, but yeah, so I can't.
That's another key takeaway for someone who's in the throes of having a new baby, whether it's you're pregnant or just like you're gonna keep learning from your
Yeah,
child for forever, and that's such a gift. And that you know sometimes just chasing around after them can be your
yeah,
exercise.
yeah, yeah,
Yeah,
yes, absolutely. Yeah, your energy demands are your form of exercise is going to be completely different. It's not going to look like running on a treadmill or picking up dumbbells. It's going to be picking up toys and picking up your baby and
yeah,
putting
yeah.
him in. Yeah,
Better than a sandbag.
yeah,
I'm
and you're
into sandbag
just
training now, but baby, I think has more wiggle room than a sandbag. So that's
yeah, and they just keep getting heavier too.
yeah, yeah.
Yeah,
Um,
yeah.
so so what do you have any programs coming on, going on? Like what are you working on? What's coming on? What's going on in your world now that's
Yeah, so I'm working on returning to run postpartum, a program for that. I'm kind of breaking it down into early postpartum exercises to focus on, that like 0 to 12 week, and then this other portion of it is strength training progressions for the after the 12 weeks. And really, I'm just using 12 weeks as a general guide. Not everybody is going to need to wait 12 weeks. It's going to be different, but it's just that we're right now, like the latest literature is saying that 3 months is a great time to really start ramping it up. Granted that you've kind of hit these milestones, like these key things, like having good pelvic floor awareness and things like that. So yeah, it'll have strength training progressions for getting back to running. It'll have that self-assessment, return to run self-assessment to kind of identify areas of weakness. And then I'll have little bonus sections for considerations if you've had a C-section or if you have diastasis, just education around that. And then it'll kind of wrap up and how to stay strong throughout your motherhood, and just like we're just talking about, understanding that there's different seasons of your exercise journey, and right now it's like slowly is building your base right now, after having your child basically. So yeah, there will be times that you need to modify your training in general, even if you one didn't have a baby, if you got sick, if you had some kind of life event happen, or you just, yeah, everyone has like a hiccup in their life that demands them to change their exercise regimen. So is this kind of like that reset button, like how to get back into exercise, but particularly running for this program. So yeah, that's that program. It's not finished yet, but I will let you know when it is. It's a work in progress. But the checklist that I just kind of went over and we discussed, it's a free checklist that I have, and I can give you the link that people, if they wanted to read it.
cool. Yes.
Yeah.
Let's do that. We'll put it in the show notes.
Yeah.
And then how can people reach out to you if they want to learn more about returning to exercise and running postpartum or
Yeah. I love when people ask me questions. I enjoy it. So I'm pretty active on Instagram. My handle is Adrian _ the movement doc. I can give you the link for that, or you can email me at adrian@themovementdoc.com. And yeah, I'm an open book. I love ideas if you had questions or yeah, suggestions and content and whatever. It's all a work in progress here.
that's perfect. And I think that I always do better when people ask me questions because you're always like, well, what do you want? So this is my push to people who are listening. If you have questions, reach out to Adrian because she's a wealth of knowledge and can really answer, and have a conversation. And if she doesn't know, I'm sure she'll direct you to someone who is in that can better answer the question. So
Yeah.
Always better to ask a question.
Yes. Yeah. Thanks,
Uh,
Laura.
is there any other piece of advice that you can give or that we missed?
Um,
Talked about a lot. So.
yeah. Yeah. I mean, enjoy the process because yeah, this time of your life is going to be a thing of the past. So you may as well make it a memorable one and yeah, get back to exercising um, in the healthiest way possible. So there's so many resources nowadays that can that can help new moms feel better in their new bodies. So don't rush it. And yeah, there's experts, there's professionals that can help guide you. And if you don't know where to start, just ask. Just ask. Yeah.
Well, thank you so much for joining me today. I really appreciate it. And this is a topic that I'm interested in learning more about because I can see I think that it doesn't have to take a super long time for people to get back into moving,
Yeah.
once when they've had it. But having some guidance can be a huge help and a huge benefit. And so the more I learn, it can help also. So I appreciate that. All
Yeah.
your checklist and all that.
Yeah. Knowledge is power. Just having this guide or even just knowing that what's normal or what's not normal, like all of that helps people like realize like, okay, this is how it's supposed to be. And like, yeah.
Yeah, for sure. Cool.
Yeah.
Well, let us know when your program comes out.
Yeah.
And we'll definitely post that. Thanks for joining us, everyone, today. Check out all Adrian's stuff. That'll all be in the show notes. And don't forget, when in doubt, breathe it out. Take life one step at a time. And as my friend Drew Kelleher said, you're responsible for your own vibes. So go get the day.